Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We're going to find out all about managing your health with medications. It's an important subject, and I have an expert here, Dr. HAL BENDIT, who is with the Medical Center Affiliates, also known as MCA. You know, we were laughing about this when we first met him. It's YMCA. You know, that's way good to remember. Sorry, to bring a little lightness into this. But Dr. Bennett, I'm certainly happy that you're with this excellent group, MCA. And how did they find you?
Well, I practiced in Allentown, Pennsylvania for about 28 years, and my wife and I decided to make the move down to South Florida, and I guess I found them. I was looking for a second career, and they gave me that opportunity up in Lake Worth.
And so, do you find, this crazy question, you have to be careful answering it, do you find people are different, the older folks are different down here than in Pennsylvania?
I don't find that there's necessarily a geographical difference. The area that I practiced in had a lot of Pennsylvania German, so there were cultural differences, and there are more different cultural challenges down here. We have more Hispanics than we have Pennsylvania Dutch, obviously Pennsylvania German, right. And so there are a lot of people, snowbirds, and people from up north, and nobody's from here. So, and I'm not from here, so I fit in.
My first husband was Pennsylvania Dutch. Trust me,
right?
I know the difference. I was only, yeah. So no, I like it down here better. No, they're more easy, I think, easier, not as traditional. But just talking about that, the reason I ask you that in really a serious way is that I think that South Florida does enhance a person's life. I think so many people seem to live longer. They live better, higher quality, because they can go out so much more often and they don't have to stay in their apartment. It's cold, it's dark. Mm-hmm. What do you think about the environment as far as health goes?
I mean, there have been a lot of studies in geriatrics, which is now the primary focus of my professional attention. A lot of studies in geriatrics that show simple movement increases your longevity, increases your health. Just getting up out of the chair, walking, swimming, any kind of movement on a daily basis. No question.
And then, so, because people up north, of course, they have ice to deal with, snow and the cold. And yeah, so I think...
Yeah, there are obviously more opportunities to be sedentary in the wintertime than there are down here.
Right.
And I think people take advantage of it as well. They should, the Florida weather.
Yeah, it's funny how we see so many of the older adults and now their kids are coming, boomers are moving down because they realize that it's good. But that being said, the one thing that I have noticed, and we were talking about, and your article says it so well, and by the way, everybody, the September magazine has just arrived, so be sure to pick it up wherever you get it. And you can get it at MCA, and Dr. Bendit is there at the MCA Point Siena office, so you can go there, and we'll tell you where that is. That's actually over there on 29, it's via Point Siena. It's in Lake Worth, and you'll see that beautiful entrance called Point Siena, and you go in right there. You're right outside there, I believe.
Right behind the Wells Fargo Bank.
Right. Okay, well, just getting back to this. I noticed that there are a lot of people who do become over-medicated or under-medicated, and it's not the fault of the doctor. What happens?
Well, I think the first thing that you have to realize, it's all about the doctor-patient relationship. When somebody comes into my office, I want to get to know them a little bit on the first office visit, and I want to let them know that their health care is going to be a partnership between myself and them, shared decision-making, if you will, which is kind of a buzzword in the medical community right now in terms of dealing with your patients. And I tell them that, they need to tell me what they're doing, and I need to explain to them why I want them to do something or the other. And I tell them my job is not just to tell them what I think they should do, but explain to them why, so that they participate in their own health care. And it seems so simple, but one of the biggest challenges to me in taking care of patients is the med list. And that's why, when I was asked to write a little something about what would be advantageous information for people who are taking medication, I decided to write this. Your doctor can't really understand what is the best medical advice for you, how to change your medications, how to change your blood pressure medicine, whether you need to change a blood pressure medicine or a cholesterol medicine or any medications if he first doesn't know what you're taking. And an inordinate amount of time is spent in the context of an office visit for me because I need to get comfortable that the patient is telling me exactly what they're taking and that they know that and they're doing it properly. That's one of the first things that I do when a patient walks in the door.
You said something at the beginning, which I'm laughing because for years, doctors didn't want the patients to know too much. No, I mean, I'm serious. They would say, I'm the doctor. You do it. They weren't patient like you. I mean, I'm an older person and I know what it was like. And it has made doctors change because, and yet it's on the other side that's not good. They see everything on television. They come in, I want to take that. How come I'm not taking that, right?
Right, right. And that's part of the back and forth in a conversation with a patient. There should be some teaching going on. The patient needs to teach me about them, and I need to teach them about what it is that they should do to maintain their health.
Yeah, well, that's a good attitude. And, of course, we hope that you have the time for that. A lot of doctors, unfortunately, don't seem to have the time to do what you've just said.
It's one of the challenges of practicing medicine in 2016. Everyone knows it, yes.
Yeah. Well, but one thing I do know about the folks that started MCA, they appreciate that. And they understand that. They're very good for patients. I know the founders, and I think that it's something that they want to happen. I mean, you can't. Some people, of course, want to come in and just tell you their whole life story and all, and I'm sure that you're able to get down to the facts. But you're right. You have to listen because if you don't hear them, then you may not really understand what the situation is.
Yeah, and in our practice, I think we have the structure that I can spend 15 minutes with a patient. If they need 15 minutes, I can spend half an hour with a patient. If they need a half an hour, I just got to this on time because I had to spend 45 minutes with a patient. But
Thank you, but it's okay.
But that's what he needed.
Yeah,
so.
Exactly. Yeah, that's wonderful that you did that.
That's important.
Your points just went up. That's great. I love that. That's really good. All right, well, let's get down to when you talk about the green pill, the red pill. Pills are identified by names, but most people, they're too complicated. So that's what they say. Well, I have to take the red pill or the green pill. Well, what can you do about the names? I mean, what are they supposed to know?
Well, the easiest thing is to keep an accurate list. Or I should say the best thing is to keep an accurate list. It's not necessarily the easiest thing. When a patient comes in with a list of medications that looks like it's been updated, not the crinkly piece of paper that's been sitting in their wallet since the Eisenhower administration, and I get convinced first off the bat that this is a patient who's involved in their health care, that I can trust that this is the right information that I'm getting so that I can give them the best medical care. So keeping an accurate list. And we like our patients to bring their medications in the bottles to each office visit.
Really?
Yeah, absolutely. So I can look at the bottles. I can see what the refills have been, whether they're due for a refill. Maybe there are some empty bottles. I can tell, well, you haven't taken this medicine in a week, a month, what have you. So we like all of our patients to bring all the bottles to every visit. That way I can also tell if another doctor has written a prescription. Patients have cardiologists, they have gastroenterologists, they have podiatrists, they have dentists. They could be on they have medicines from the ophthalmologist. A lot of these medications have side effects, and even if they don't have side effects, it's important for me as the primary care provider, who's kind of the captain of the ship, to know what else they're taking so I can make an intelligent decision.
Dr. Bennett, I am so happy you said that. You should be the captain of the ship, but I call it the conductor. I never see that there is someone. One does not seem to know what the other doctor's doing. So how does that happen, or how can you prevent that from happening?
Well, that's a real problem, and that's a system-wide problem in healthcare today. And there are a lot of initiatives that are going on from the federal government on down to try to address that. And one of the initiatives is called Transitions of Care. Patients probably don't know about it, but one of the big issues in medicine, and when I say issues, I mean problems with quality of care and cost of care, is when a patient goes to an emergency room, or when a patient gets taken into a hospital, or when a patient gets discharged from a hospital, that medication errors occur. And all of this can so simply be dealt with by keeping an up-to-date list of your medications. And you don't have to remember their complicated names. I have a lot of patients, and I know people are using their iPhones all the time. There's actually an app on the iPhone that's a health app. And if you open up your iPhone, you don't need the password to get into this. It's a little square with a little heart. It doesn't need to be downloaded. It's on every iPhone. It just comes with an iPhone. And when you open it up, it gives you the opportunity to list all of your medicines, list your surgeries, list your diagnoses, list your allergies.
I know what I'm going to be doing this afternoon. I'm going to look at that. I have
you
never.
Want to look at mine?
Yeah, well, you show me yours, and
Sure.
I'm Josh. Let me just tell you, I've
in
never heard of this before.
Yeah, it's the heart.
Yeah, but how come?
Could
that be your next article?
It could be. If you're God forbid in an accident, or you're found at home.
Everybody knows that, right?
They should, because they can open it up, and they don't need your password to open it up.
I am so thrilled that you did this.
So that's one of the things we talk to our patients about.
Oh, my goodness. Okay. Well, you can go now. I've gotten everything. That is just delicious to hear that. See, that's why we have Boomer Times and the radio shows, because we have a lot of people listening for 25 years. They've learned so much. And just what you did in this last 2 minutes can make a big difference. I know I'm going to do it, and I'm going to tell everybody I know. Say, do you have that on your app? And have you put everything in there?
And that's specific to the iPhone. There are other apps out there you can buy, obviously, to keep a record in your phone. But just bringing a list, or all of the electronic health records now that are pervasive in your doctor's office, because myself, like all the other physicians, are stuck behind this big screen, which I don't want to be behind the screen. I want to be in front of my patient.
Sure.
But all of these electronic health records should have the capability of printing your medicines at the end of each visit.
Well, and then, of course, I like the idea of bringing your medicines only because a lot of our much older adults, they don't have the iPhones, they don't know how to use this.
Right.
So you're giving them a choice.
Right, but if you bring your medicine to the doctor, they make sure that list is okay, and at the end of the visit, they can hand you a printed, legible list of the medications that you're on. That you can take with you to your next doctor, or to
that is
wherever
just
else
wonderful.
Whoever else needs that.
Right, that's wonderful. So when you were going to medical school, well, you're young, but a lot of doctors didn't have all this when they were going to medical school. But now I'm sure they teach that, as well as nutrition and a lot of other things they didn't teach, right?
Yes, correct.
So in your asking them about their medications, you ask them about their nutrition?
Do I ask them
about what they're eating, or what
Absolutely.
they're...
Absolutely. If they're iron deficient, if they're B12 deficient, if their protein is low.
Right, so you've taken their blood tests, and then you know what to tell them.
A lot of older folks don't get the protein that they need, and that's a problem. A lot of patients who are older who are iron deficient because they don't eat a whole lot of red meat, and that can be a problem, especially if you have other concomitant illnesses that will lower your blood count to begin with. So
that's very
nutrition is important.
Good advice. That's right. They're always told to eat your fish. Don't eat red meat, but there has to be then some sort of a substitute.
There's got to be some red meat in your diet, absolutely.
What?
Has to be some red meat in your diet.
It's funny, I'm a real red meater. I'm a real red meat eater. I like it. Mm-hmm. I do try to do the other two, but it's something I guess I've grown up with. I crave it, so I make sure I have not a lot, but some people say I can have a big 12-ounce steak, 12-ounce steak, but you can have 4 ounces of something.
There needs to be a variety,
right?
Like a balanced diet.
Balanced diet. So I think let's go back to the medication for a minute. So, do you have a special bag, or people just bring it in? I think we ought to have bags. MCA ought to have a bag.
Well,
that
we
out.
have little bags that we give, but you don't. I mean, hopefully you're not on that many medications that you need to bring it in a wheelbarrow.
No, but how many medications?
That could be a problem.
Typically 5. Your patients, because you have an older, you're geriatric.
The older folks, the typical patient that has hypertension, diabetes, and cholesterol. I mean, you're talking about at least 5 medications.
Yeah, right.
And that's a challenge. If you have a medication that you're taking 3 times a day, and a medication that you're taking twice a day, and a medication that you're taking once a day, and some of your medications say take on an empty stomach, some of them say take at bedtime, I'm challenged with the few medications that I have to take.
I agree with you.
And I'm not, I'm not in my 80s or 90s, and it's got to be a challenge. It's very difficult, and it's something that.
And so, what's your advice about that?
Well, there are a number of other things
the pill
that
box.
we talked about, which obviously
the
pill box is the best. That way, you spend $1, you go into the dollar store, all the pharmacies have the pill boxes, morning, noon, and night, or morning, noon, evening, and bedtime, the 7-day-a-week pill box. You can lay your pills out for the whole week. And the nice thing about that is if you are sitting in your condo or home or wherever at noon and you wonder whether or not you took your lunchtime medications, all you have to do is look in the box at the noon, open up that noon flap to see if the pills are still in there.
But some things are liquid, so I guess for that
some things are liquid.
You can't.
That's a little different.
You could put a little note in there,
right.
liquid,
Absolutely.
and make sure you take it.
Absolutely.
Oh, am I going to bother my husband?
Absolutely.
He has no
and,
idea.
These techniques aren't just for patients that have cognitive difficulties.
Right.
I mean, you can be completely with the program and have difficulty managing 6 or 7 medications that are all on different schedules. It can be a daunting task, especially if you have an active lifestyle.
Oh, absolutely. So my guest, this very smart, nice guy, Dr. HAL BENDIT, is really, I want to call him well, he's not a geriatric physician. He's a DO who understands more than just saying hello to a patient. He really wants to get into their head, find out what they're doing, what they're not doing, and help them. And he is working with MCA, which is called Medical Center Affiliates. They accept most Medicare Advantage plans. If you want to get on the web, it's medcenterinc.com. medcenterinc.com. And he's over there in Point Siena. And as a matter of fact, I expect to go to one of those seminars. And I probably should go to yours. And are you going to talk? Is that what they do?
Well, you're welcome to stop by. We'll have some more fun.
Right. That's right. It's a meet and greet, refreshments and all. Wednesday, September 21st from 2 to 4. And you can even enter to win a $25 gift card. But for those of you listening in Broward County, there is an MCA in Deerfield Beach. And they will have a meet and greet on Wednesday, September 21st from 11 to 1. There in Point Siena, it's 2 to 4. And in Boynton Beach, it's really closer to me, but so you only stay in the one, you're only going to deal with Point Siena. You don't flip to each one of them, do you?
No, usually I'm in Point Siena.
Oh, okay. Well,
we have weekend hours that we all cover in different
you
locations.
have weekend hours.
Yes, Saturday.
I hadn't heard about that.
We have Saturday hours in 3 locations.
You have Saturday hours.
Right, yes.
That's fabulous.
And there's always someone available 24/7. You can always get a hold of a doctor.
But you actually can go to the center on Saturday from what,
from 9 to 1.
That's excellent news. That was unheard of for years ago.
Yeah, we have one of our Broward offices is open on Saturday, West Boynton and West Palm.
Super. So the one in Boynton Beach is Friday, September 23rd, 11 to 1. Be sure to go there. It's a meet and greet, and you'll get to see a lot of the good folks there. Okay, so let's keep going on with medication, because I think medication is one of the most important issues that anyone has. Do you ever, how do I say this? The goal is for me, I don't want to take any medications, and I don't. But let's say something happens and I have to take something, but I do everything you tell me that I don't have to take it anymore. Are you trying to get people off medications if it's something simple? Is that a weird question?
No, it's not a weird question. Who wants to be on medications? I mean, this is a conversation that I've had many, 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 many times over the years, and we can talk about this in the context of hypertension. There are studies back from the 50s that looked at groups of patients who are hypertensive and groups of patients that are normotensive, and looked at all kinds of endpoints: heart attack, stroke, kidney failure, eye problems, longevity. And there's no question that the evidence shows that patients who are hypertensive are at risk for all of those things versus patients who aren't hypertensive. So once I've discussed that with my patient, then I talk to them about, okay, the next question generally from the patient is, but don't these medications have side effects? And yeah, absolutely. Every medication has side effects. That's why we see you every 4 or 6 months to make sure you're doing well with the medication. But they've also looked at patients who were hypertensive on medication and patients who were not hypertensive, not on medication. And those two groups fared about the same in terms of those endpoints that we've talked about. So the bottom line here is that you shouldn't be afraid of the medication. You should be afraid of being hypertensive and not being controlled. And that's just an example. And a large percentage of patients over the age of 55 in this country are either pre-hypertensive or hypertensive. Now, not all of them need medications. Some of them might just need lifestyle changes.
That's what I was just, my next question. You knew I was going to say that.
Some of them might just need to be out of my office because they have white coat hypertension. But there are some people that need medication. And those patients, then the next question is, well, how long do I have to take this medicine? Typically when you develop hypertension, that's not something that medication cures. It's something that medication controls.
But lifestyle changes. So let's say exercise, weight loss. What else?
Exercise, weight loss, diet.
That's it? Oh, diet. Okay.
Sure. I mean, those things.
And they can really control that hypertension, can't they?
They can. And I've, once again, I have the experience to look back over my career, and I can tell you that I've seen patients that have lost 60 pounds, whether it be changing their lifestyle or having surgery. And some of those patients were able to get off blood pressure medicines. Some of them weren't. And I have skinny patients who are hypertensive, and I have morbidly obese patients who aren't hypertensive.
How is that possible?
Well, the medical community is not really sure why. What causes hypertension? 98% of patients have something called essential hypertension, which means essential hypertension, which means we don't know why you're hypertensive. We have different medications that affect mechanisms in your body that will lower your blood pressure, but we're not necessarily fixing something that's causing your blood pressure to be high. There's no cure for hypertension. There's a control for hypertension.
So it's a control. One thing that I think we missed is stress.
Stress, absolutely.
It's hard to get rid of them.
Absolutely, yeah.
You have a bad marriage, I guess you
can.
Well,
or trying to drive down I-95 to be in time for this interview.
Right. Or for me to drive down and get here on time for me to have my interviews. That's my big stress, right? That's very good. So when you were going to medical school, what made you go to medical school? Why did you want to be a doctor? Is it in your family?
No, not at all.
Not
okay. At all. I really enjoyed the sciences. I really liked going to school. Medical school was great. If I could do another part of my life again, I would definitely go back to medical school. I had a great time, and it was something that I really wanted to do. I enjoyed it. And I'm able, even looking back on it now, to have had a career where I can, make a good living and make a difference, take care of people at the same time. So both retrospectively and prospectively, that's why I became a doctor.
Well, that's excellent. That's fair. And of course, there are a lot of people. It's funny. I have surgeons come in here, and I said, "Did you always want to be a brain surgeon?" Absolutely. When I was a little kid, I wanted to get into people's brains. You hear that. Of course, some doctors have changed their even change their particular specialty from getting into something. But that's good. I'm glad that you're there at MCA. Let me just tell everybody again. MCA, you can, for information, you can call 888-622-1225. That's 888-622-1225. And if you've liked Dr. Bendit, you could actually go find him at the MCA Poinciana office. And that's over there on, that's on 3818 Via Poinciana, Lake Worth. Just make the phone call, though, to your 888-622-1225, and they'll get you where you have to be.
Yeah, it's real near the Lake Worth and Jog intersection.
Lake Worth Jog. That's good. That's the one funny thing about down here in South Florida. There's very few numbers. I mean, you have to tell where it's near to get to where you're going to get there. Okay, when you said something interesting, you always say, don't wait for the last pill. And the patients say, well, I didn't want to bother you, right? And you said, please bother me. My husband, unfortunately, he goes to Walgreens, and unfortunately, sometimes he needs the pill and it's not ready. They don't have it for some reason.
Right.
And so sometimes we have to call different Walgreens. So you're saying that he should have not waited that long.
Well, I mean, that's a challenge to try and keep patients taking their medication. So, if you're calling my office because you took your last pill yesterday, we're going to be challenged sometimes.
Yes.
Filling that prescription right away.
Yes.
But if you call me when you have 3 or 4 pills left in the bottle,
yeah, then that makes it a lot easier.
It's certainly less of a problem. Yeah.
Well,
I want to be bothered.
I know
because
you
I'd
do.
rather be bothered with the first thing than
right.
the other thing.
Bother me. Come see me. He says, okay. Well, Dr. Bendit, this is just absolutely wonderful talking to you.
It was a pleasure being here. Thanks for your time.
I hope that we get to see you, and we're going to get over there to one of those meet and greets.
I'll buy you a cup of coffee.
I'll take it. Thank you.